Yeah, ma. Got it, ma.
Good afternoon, all. Welcome to Vayomanasa Sanjeevani webinar series. Today we are conducting 173rd episode. We have our moderator Jambunathan sir. He is a retired official from the State Bank of India, and he is also a volunteer in Vayomanasa Sanjeevani. And today our guest is V. Selvaganapathy. Dr. V. Selvaganapathy is a senior physiotherapist from NIMHANS. So, Dr. Jammunathan sir will be giving a short info about Selvaganapathy sir. Then we will proceed the webinar.
Thank
Thank you, sir.
thank you, Jyoti. So, namaste and good evening to Dr. Selvaganapathy, resource person of this evening, Mrs. Nisha and Jyoti from NIMHANS, who are providing online and offline support for conducting the webinar. Dr. P.T. Sivakumar, Head of Geriatrics Department of NIMHANS, his team of doctors who are responsible for starting and providing support for these webinars, the enthusiastic and inquisitive viewers and participants of this webinar from across the country. I have great pleasure in welcoming you to yet another edition of this webinar being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatrics Department of NIMHANS, Bangalore. I am happy to welcome and introduce Dr. Selvaganapathy, resource person of this evening. In fact, to tell about Dr. Selvaganapathy is very big. He is a highly educated person and experienced doctor in the field of physiotherapy services. As regards his educational background, after obtaining his basic physiotherapy degree from College of Physiotherapy at Tiruchirappalli in the year 1995, he obtained his postgraduate degree from the Oxford College of Physiotherapy, Banglaore in the year 1998. He had then joined NIMHANS and obtained his doctorate degree in the year 2013. Interestingly, his doctorate degree is in balance and gait research and behavioral variant of frontotemporal dementia. He is presently working as a senior physiotherapist at NIMHANS, one of the most prestigious teaching institutions, one of the in Asia. His job responsibilities include clinical teaching and research, as well as administration of physiotherapy services. He is a specialist in assessing balance and gait and help them in managing various neurological disorders. Currently, he works in close association with the movement disorder wing of the neurology department. His research has been published in journals such as Movement Disorder, Asian Journal of Psychiatry, Journal of Neurological Sciences, etc. He has received a bursary award to his research work at the International Neuropsychiatry Conference in 2018. He currently works in the Geriatric and Pediatric Neurology units, the Child Guidance Clinic, the Chronic Pain Clinic, and the Balance and Gait Lab. A few of his tests are clinical tests of sensory integration and balance, postural stability tests, and motor control tests using dynamic spectrography, that is Biodex Balance Master USA. He conducts pneumatic gait analysis using gait right, treadmill gait analysis, etc. The training includes feedback-based balance and gait training. Patients with Parkinson's diseases, PSP, HD, SCA, dementia, stroke, and neurological disorders are treated by him. His teaching responsibilities include training interns and postgraduate students posted to the psychiatry department, facilitating them hands-on training among the physiotherapy and DM neurology students in balance and gait analysis, and actively participating in journal clubs, seminars, and conferences. We are really fortunate to hear and get benefit from his wide knowledge and experience in such diverse facets of gait and movement, which are very essential for survival at our age. It is often said that fall is one important event that we as seniors should avoid. In today's session, I request Dr. Selvaganapathy to tell us some important tips to avoid falls while engaging in our daily activities. As a time management tool, I request participants to ask their questions if any, in the chat box for him to answer. You may also raise your doubt after the resource person finishes his presentation. Yes, Dr. Selvaganapathy, we thank you for your kindness to spend time with us and educate us. The floor is now open to you. Please go ahead with your presentation. Thank you, Doctor.
Thank you, Jammunathan sir. Uh, that was a great introduction. Thank you so much. My association with Vayomanasa Sanjeevani is continuing almost a similar topic I have done earlier. But then this topic, I thought I will go further to explain the physiology of balance and gait problem. That's what will lead into falls. So if we understand the mechanism of the fall, then we will be able to prevent it better. So that is why we are going to deal. If you have any difficulty in understanding, you can stop me anytime. This is something sometimes by mistake, if I'm using some terminology which you don't understand. As much as possible, I have tried my best to simplify it, because this is something little complicated to explain all the brain structures, which is actually responsible for our balance control, so that we don't fall. So fall, we are saying it's simply we are preventing it, but then there is a whole machinery working in our brain to do that job. So in this session, we are going to see how does that happen. So it will be an interesting thing, as well as you will be able to appreciate it, like how we can maintain it. So we will be briefly covering all these aspects. The first one is the neurophysiology of the balance and gait, which means how do we control our balance, how do we prevent falls, how our walking is achieved, how we are able to walk, how the brain is doing all this job. That we are going to see what is the internal mechanism happening, right? And in the second topic, we are going to see what disease or disorder or some aging effect is going to affect our balance and gait. So that we can be prepared for that and manage it as well. And the third one, in general, how do we improve our balance and gait function? Okay, in that context only, the importance of the aerobic exercise will be briefly explained. And then how do we stick to the active lifestyle? Like whatever we do, that has to be throughout the day practiced. It is not like one session, two session.
Yes, sir.
How do we be totally active throughout our day, so that physical activity, how we can improve that? Sometimes we need some extra techniques, that is something called behavior change technique, that will be explained, so that we can physically active means we have a well balanced life. So in that context, there is a person environmental model also will be explained. And I'm going to share some of the balance exercise videos as requested by Jambunathan sir. So these exercises generally we prescribe to the patients who comes to us after doing the testing. We have the balance and gait lab. We do the test. Based on that, we advise it. And then we give this video as a home program. Once they go home, they can always view the videos to do it. But I wanted to go one level ahead, like even if you don't have or immediately not having any issue, but I want you to practice these exercises, but with only one condition, that is someone should be with you. Don't practice it alone. Okay, so these exercises might be, you can practice it. This YouTube video links, actually, that YouTube is created by us from our department. It is not for circulation. However, for the larger interest of the public or the group, we are planning to open up in this particular seminar. Fine, sir. Let me move to the first topic. neurophysiology of balance and gait. So, how do we balance ourselves? Have you any time wonder how are we able to manage standing stable without falling? Can anyone really thought about it? Like today we will be open up that. So why we need first of all balance? Because we have to stand and do some activity without falling. Then only we can be very functional in life, right? We do carry out many tasks in standing, and we need to be very independent in the society. For that, we need this walking and the balance. No, it's very important. So how do we balance ourselves? So these are the ingredients we can say, like to have that no nice meal of it. Like if you make a meal, you need some ingredients, right? If you consider balance as a no product, and then how does that balance is achieved? So we have our sensory organs in the form of we are able to see things through our eyes. The eyes are actually capturing the information from the environment, like where do you stand? Is there any obstacle over there? What kind of surface it is? All those informations are actually gathered. In a way, your eyes are a sensory organ which is feeding to your brain. It conveys some information to your brain saying that this is the surface. The surface is even or firm, or the surface is slippery, or no, maybe sandy or uneven. All such information you gather through your eyes. That is actually, again, you need a cognition to understand. That will be taking into your consideration of what kind of surface you are standing. Then comes the sensation from your leg or from the joint or from the sole of the feet. You can always touch and feel, right? The touch feeling, like when you touch, your brain is able to identify where you have been touched. I mean, somebody touching or you are touching something. All that information is coming into realization because we have got some special structure in our feet and the joint which is telling that information to your brain, like about the surface of where do you stand. Okay, and this information is all very important in order for our brain to do some action so that you don't fall. For example, you stand on a slippery surface that your sole of the feet and your joint angle is telling the brain it is very slippery. Then your brain is making a program to produce a muscle action that is making your body little tight and little cautious so that you don't fall, right? So these are the ways we are able to balance ourselves. The brain is doing this wonderful job. We have another system called vestibular system, which is situated right inside your ear, middle ear, inner ear, we call it as. This is something like a small circular structures which has got some fluid. Okay. Why this arrangement? Because this is taking care of your body orientation or alignment in respect to the head. When your body is tilted, something like you tilted to one side, you see there is a changes happening inside your middle ear, that the semicircular canal, what we call it as a vestibular system, is making some movement. When this fluid is moving, the body is sensing that your body balance is changing. Okay, so which is in terms of center of gravity. Hope you all might have heard this term, center of gravity, which is generally located in the back region of lumbar region of your body. So whenever there is a tilt is happening or imbalance is happening, your head also moves. That is being sensed by your vestibular system, saying that there is a problem in the balance. There is some tilt is happening from the original COG placement. Then your base of support is changing. You are not standing on 2 feet, you are standing on 1 feet. So all such information, your eyes is telling the information about the environment, your sensory organ is telling what kind of surface you are standing, Your vestibular system is telling that there is an imbalance is happening, there is a misalignment of COG. So all such informations are reaching to your brain. And then your muscular system in terms of response to this demand, okay, whatever the information. Based on that, it is making your muscle either no particular muscle to act. Maybe in your ankle, that is at your foot level, maybe in your hip region, some hip muscle will work, or your back muscle, or your tummy or abdominal muscle, we call it as. Your tummy muscles will be tight, or your hands, hand will go up. So these are the ways your muscular system is responding to the challenges to the sensory system, which information received through sensory system. So you have this combination of sensory system and muscular system. The sensory system is combination of your vision, your sensation in the feet, your vestibular system all together, along with another system called cognitive system. Cognitive system is nothing but your thinking brain. A thinking brain is nothing but your world information and the characteristics of the substances, all you have gathered knowledge. That knowledge, the gathered knowledge has been further processed inside the brain to make some action or not do any action. For example, when you walk, you notice there is a banana peel. Somebody has eaten banana and carelessly put the peel of the banana. Will you walk over it or will you just avoid that? That decision comes from your cognitive system, because your cognitive system knows that banana peel, if you step on, it will be slippery, you will fall. So you don't have to step on it. This is the cognitive system. So you need all this combination. It is not just an sensory information. Your motor action is happening, but your cognitive system also processing all this information and give that idea of how to act, so that you are having a better balance or you are avoiding falls. So this I have simply put it in what to say, in a very simple form. But how does that really happens when your muscles are acting? We call it as weight. Before to that, now we call it as your strategy. Your body is making a strategy to avoid the falls. I said your muscle is contracting in particular place. For example, you are able to see the first picture. The person is standing straight. Suddenly, he's been pushed. A blue color, the appearance you can see. The person is standing here, but now he's been pushed. He's going like this. So what happens? So what muscle he's using? He is predominantly going to use this muscle at the ankle or at the foot region, especially the calf muscle. Okay, then the calf muscle is responding in such a way that it is strongly contracting so that you don't fall. Similarly, your back muscle, which is also become very tight in combination with your calf muscle, then you are not falling. With that muscle contraction, you can prevent your fall. By chance, a force is applied. We call it as perturbation. Suddenly, we call it as perturbation. It means you have been pushed with some external forces. Your COG is altered. But then you are managing the fall by bending from the hip, because this time the force is more. You cannot manage with your ankle muscle or back muscle. You are doing the opposite of it. You started using your front portion of your leg, that is your dorsiflexion, we call it as. There is a front muscle that comes into action at the ankle or foot region, as well as your abdominal muscle. Earlier the back muscle, now your tummy muscle is contracting strongly to prevent the fall. And third scenario, the force is very much more, you cannot control your balance. Then you started making some step also to balance yourself. That is called stepping strategy. So that strategy makes your body to move about 1 or 2 steps so that you don't have to have a fall. So this is how a balance is being generally experienced by a normal individual who is able to balance himself, maintain his COG within the base of support, right? We call it as good postural stability, right? So for that, this much mechanism is happening. Cognition, sensory, and motor system, right? Why we need to know all these things? Automatically, whenever there is a problem in any of this system, due to aging, due to disease, due to disorder, you are going to face the problem in balance. That is the reason you need to understand why the sensory system or motor system or cognitive system are all very important. Why to preserve that? Why to maintain those systems in good condition so that you are not get into trouble. Okay. Now, talking about walking. So this is for when you stand, you have this balance problem, or while walking also, you may have a problem. How do we walk? How we start making steps, right? Let us understand that component of it. Now, this is how you are going to organize your walking. I am not going to talk in so many slides about walking because the idea is you need to know some of the brain structures are all important, and that is the reason when this brain structures are affected or the muscles are affected, then you are going to have a balance problem. See, for first picture, you are able to see there is a blue coloration. We call it as prefrontal cortex or a cognition. Sometime back, I mentioned about the cognition or your thinking brain or the world knowledge, everything is being, or execution, we can say. Any movement you have to do, you know the sequence, right? How to do the sequence. That execution is done from this brain. So walking is also an act of some mechanism of body transported from one place to the another place, correct? So in order to achieve that smoothly, like your walking should be smoothly, how does that happen? First thing is you have the desire or the motivation of walking, like you are tired, you want to get out and go for a coffee, or you are getting ready to go to office, whatever the reason, going to temple. So you need some mobility, there is a reason for it. That reason is being processed or conceptualized in your front portion of your brain, which is prefrontal cortex. That's a thinking brain or your executing brain. Now that sends information to the area called basal ganglia. It's a small structure inside your brain, a subcortical structure. That role is, it is something like a starter button, like you would have seen in the old this kind of lights, tube lights. They put one small thing called starter, right? That starter, if you're not putting, the light won't start. Similarly here, even though you have the desire to walk, then this basal ganglia is another neural structure, has to be activated. In fact, your prefrontal cortex it sends the information to the basal ganglia that initiate the steps. So this function is to initiate and coordinate the movement. Further, it will go to the brain called small brain area called premotor cortex. Like this motor cortex, primary motor cortex, this is the primary motor cortex. From there, the main fibers are coming, which is called corticospinal tract, which is going to your spinal cord, which is on your spine. Inside the spine, there is a spinal cord. There, it coming to the leg, where that movements of flexion, you are bending and stretching, you're making one step, and another leg is stabilizing on the ground, and then you are advancing by keeping one leg on the ground, one leg on the air. So this is what we call it as walking. That has been nicely controlled. In fact, initiated from your front portion of the brain, then inside on basal ganglia, then your corticospinal tract, and then your spinal cord. Your spinal cord alone can keep on maintained for further walking, unless otherwise you suddenly come across a novel situation, like you have to cross something, you have to step on an obstacle, then your vision is going to tell your brain that, see, can I cross this or can I step on it? So that processing happens. That time again, your corticospinal tract will come into action. Until then, your spinal cord alone can run the show. It is something like is given a job to or franchise the job to the spinal cord. Spinal cord will run the walking, right? Now, what does that cerebellum does? Cerebellum is something like a manager, which is monitoring our walking. So if anything goes here and there, it tries to put things into control. It means it regulates the coordination of the movement. It is happening in a rhythmical manner. It is happening appropriately. It is not overdoing it. For example, you make a step of 1, 2, 1, 2, like a rhythm, and you are keeping it in the right place, right? But that is controlled, or it is managed or monitored and altered by a small structure in your back of the brain. This is what we call it a cerebellum. Hope you are able to see the marker.
Doctor,
And,
one second. Doctor, one second.
ah,
These slides, can
Hmm.
we individually, I mean, make them big?
each one.
Yeah.
No?
Can we, I mean, do you
I
have the
don't think so, sir. This will only move like one. This is one slide I put.
one
That is
slide, totally one slide with
one
the
slide.
different pictures?
You are, is it looking too small?
Yeah, I mean,
Ah.
We
It's
can't
coming
read them.
in their
people are
slides
telling that.
actually,
People are telling
not
that.
a single one.
Yeah, people are telling that.
We are not able to read anything from the
See,
slides.
we have to focus on this.
I advise not to read. Please listen to me. Whatever I'm speaking, that you try to coordinate. See, this is the prefrontal. You are able to see the marker, right? What I'm showing.
A marker is there, doctor.
Yeah. See, this is the prefrontal cortex where the decision to stand or walk is happening. Then it send across one information to a small portion inside, that is basal ganglia, to start the movement. And then once it started, again it is going back to the, sorry.
We'll
Again,
understand better.
No, we
sir.
can focus better, you see.
sorry.
We can focus better.
Ah,
See, the
No,
listening as well as observing both can go parallelly.
yeah. So now this is the corticospinal tract or primary motor cortex is sending some impulse to your spinal cord. That is,
WhatsApp क्या करी मैं?
this is the spinal
प्रभा
cord.
को बताइए और
Anybody is asking something?
प्रभा को विदाई आप
We don't know which slide you're referring to.
No, I tell you. 1 second, doctor.
हाँ प्रभा को विदाई
I
उसके
have to
नाम
include
है
people.
We
और
don't know which slide you're referring to.
जाना था
Walking and
Doctor, you unmute yourself, doctor.
okay.
Yeah.
Are you seeing the slide of walking or gait? Are you able to see the slide?
Is it slide number 7?
Probably. I didn't numbered it.
Yeah,
But
waiting and
walking-
walking and gait. Yeah, gait
that slide only. That slide only I'm talking.
Yes.
How do we start our walking? How that happening inside? No. So why we need to know is you have to have the understanding different brain structure is coordinating and bringing the walking. Okay. And the walking is controlled or managed or supervised by a small structure in the brain called cerebellum. That is the back of your head actually. It's a small portion you can see here also and here also. Then you are able to make a walking. So this is the mechanism in simple terminologies. Okay. So maybe someone can probably at the end describe it so that I understand whether you really understood or not. Okay. Now I hope you understand for balance, we need cognition, we need your sensory system, you need your motor system. And for walking, you need your brain, many areas of the brain and spinal cord, right? All together it works and makes the action called walking and maintaining a balance. Now Next slide, I'm going. I'm not able to move my slide.
This is a single slide only, isn't it, doctor?
No. It is so many slides are there. No, I'm just keep moving.
Yeah, please. I mean, if needed, you just log off and then re-log in.
Now it is okay, sir. Working.
Okay.
Is in this part everybody is clear? Shall I move ahead?
No, I think, doctor, we can go ahead.
Okay.
At the end of the session, let them ask the question.
Yes. Now I'll tell you what happens when you are having problem in your brain and different structures. Hope you all heard about some of the condition like Parkinson's, stroke, diabetic neuropathy, and cerebellar ataxia. So all these conditions are all some disease or disorders of the central nervous system or the brain. Okay, so these systems are all affected, then the person is likely to have a problem. Okay, because all these conditions involves one of the other brain part, which is responsible for the smooth movement and balance. When that is affected, then they are going to have a problem. Now, we shouldn't forget about our sensory system like vision, your sensation like in diabetic neuropathy, it is affected. These are also contributing. There is some problem in your ear, like middle ear. Often people say I have vertigo problem. Vertigo problem is nothing but your vestibular system is not functioning well. That is why you are having an imbalance, like you are having a reeling sensation when you are moving in the bed, your head movement is producing lot of dizziness. That is why the vestibular problem. So all these things are all can lead to a balance problem. Okay. Now in elders also, because of the aging, some of the system, including your muscles, which is supposed to execute the movement to prevent the fall, that also can go for weakness. If your muscles are weak and your nerves are little damaged, which is not actually sending the impulse very fast. So we need a very fast response from your brain to the nerves to the muscle, then only you can balance. Due to the aging process, your muscles, your nerves, or your joints, or flexibility of the joints, all can get affected. That is the reason, as the person getting older and older, they face the problem of falls. In the even in walking also, their walking will be very slow. It is called cautious gait. It means the person is having a fear of fall because his system is not adequate to support. So he's feeling that imbalance, he's feeling some sway, body sway, or tumbling sensation, tumbling feeling. So he's thinking that I might fall anytime. So then the fear of fall also catches. So he walks very cautiously. That is why it is rightly named as cautious gait, right? So now hope you understand why we are talking about this topic, why we talk about all this system, right? Now, how do you confirm that you have this? I think others can be please
Actually, no?
muted.
Yeah, madam, kindly mute, madam.
Okay. Now, how do we know that I have a balance problem? I have some fall risk or not, so that I can take some measures. Okay, then I can really plan my intervention or management. I taking some help from doctors or physiotherapists, right? So we have got a range of tests both in balance and gait. Okay, so we have instruments to measure, like we will make you to stand on a platform which is wobbling, which is moving. How do you balance yourself? How much your balance is there? We can measure it, which is called as posturography. Okay, we can conduct range of tests. Some of the tests Dr. Jambalingam sir has mentioned, like a clinical test for balance and integration and So sensor integration and motor control test, all this test we have in NIMHANS in balance and gait lab setup. We can conduct this test and tell you your risk, whether you are having an adequate amount of balance and gait speed and all. If you ask me a very simple test which can be done at your home, which is called timed up and go test. It means you are sitting
Can
in
you
a
come
chair.
again once again? Can you come again once after once more? What is the test?
It is called timed up and go test.
Timed up and go test.
You can simply call it as tug, TUG, tug. Tug test is nothing but you sit in a chair, you get up and walk up to 3 meters. You have to mark at the 3 meter point. At the 3 meter point, you make a round about it and come back and sit. The time taken to complete this test will give you a fall risk. Generally, an adult will complete this task at 3 meter, like while going 3 meters, coming back 3 meters, and safely sitting. It'll take 10 to 11 seconds only. If a person is taking more than 11, 12, 13 seconds, up to 14 seconds is fine. Beyond 14 seconds, if a person is taking, then he is at risk of falls because he's not having that adequate amount of balance, adequate amount of that machinery which is taking care of the balance system in the body. So that is the reason he's taking extra bit of time to complete this task. So this is where we can come to know that this is the time we need to intervene. Maybe we can do some test, further brain test or scan or whatever. Now, there are a range of tests, something to figure it out which system is affected. For example, you sit in a chair and cross your arms like this and then trying to get up. How many times you're able to get up in particular 30 seconds or particular period of time. Also taken into consideration of your muscle strength. So these are the ways we can do some test, right? Then we can do an intervention. Now, this is the machine I mentioned about posturography, right? So this will give you the values, like what is your balance level, because this has got a normal values already. For example, if you are 60 years old, what is your balance should be? That will be feeded in the system. So when you stand and do this test, we'll come to know what is your value, which is comparable to normal or not. Now you can also get a fall risk test in this. Like this machine itself will tell you that you are at risk or not. Even at risk, you are having mild risk, moderate risk, or your severe risk is there or not. We'll come to know about this conducting this test. These are some of the treadmill test, gait test. This is the test is when you walk, we can capture your footprints on the mat and we calculate it using a software of how much time you take to do one step to the another step. For right leg to left leg, how much time you took, how much, what is the length of that? Is there any variation between one step to the another step? All such information, including your walking speed, like how much time you have taken to cover this distance, right? That's how we calculate your speed of walking. All such information can be gathered. Now, here I'm just trying to focus on the elderly aspect of it. I didn't want to talk about the neurological conditions, which will not permit here the time and the context also will not permit. So let us focus at the elderly. Okay, the elderly person who may have a cognitive deficit as he gets older, his judgment ability might be affected, right? So he may misjudge things and make a mistake, right? And he might fall. Okay, so how do we know? Instead of this checking the cognition, if you see his walking is slow, then you can always suspect there may be some cognitive problem. Let us check the cognition to understand. Okay, that is one way. Of course, other examination will be conducted like in proper neurological examination. But you can simply say there are studies to support if a person is walking slow or walking unstable, then you can always suspect his cognition also might be affected because that might be influencing his walking problem. And also person might suffer with some glaucoma or due to diabetic, that retinopathy, then vision is affected. We have seen how important the vision is to improve your balance. So when that is affected, then you're going to have a problem. Then that has to be checked and then corrected. Then there may be a muscle weakness or muscle tightness. As you are getting older, we are having less flexibility in our joints and muscles. So then we may have a tight muscle. Why it is important? Because you have seen that we have to timingly do some strategy. Hope you remember that ankle strategy and all I mentioned, where your ankle muscles or hip muscles are all timely should contract and it should be very flexible to act. So when the person is getting older, he might develop tight muscle that might lead to falls. Now, already I said that the sensation, your foot, you have to observe in case your foot is not carrying a sensation properly due to some neuropathy or diabetes-induced peripheral neuropathies, then your brain may not receive proper information from your feet and your joints. That might affect your balance issue. Even though brain is trying to compensate, but using your vision, by chance your vision is also affected, that will put you into real danger of balance issue. As I already said, your muscle strength reduces as you get older, then there is a possibility your muscles may not be quickly contracting to prevent the falls. Also, some of the medicines you are taking also may be inducing your falls. So this is like not only psychotic drugs I have mentioned, even some of the medicine you take for hypertension also has the risk. It is called false risk identified drugs. Okay, FRIDS. FRIDS are as a terminology they used to discriminate some of the medication which is risk for falls. So it is not a message of not to take the medicine. The medicine must be taken. For example, for hypertension, I'm telling, if you are not taking a medication for hypertension, it is dangerous. Your BP will not be controlled, then you have the chance of developing some bleeding in the brain. So better you must take, but then you can talk to your doctor whether any particular brand or something can be changed or the number of medication can be altered so that you can avoid taking too many medications. So this fall risk medication, whoever is fall risk medication like FRIDS and all, if you're taking, then you need to be at least aware that this medication alone can cause some false problem. So you can be very careful about it. Now, more than that, your environment, this we have covered in detail. That is the reason I have not put many slides on how this system, how this external factors might cause you a fall. Say, for example, you have not switch on the light, the room is very dark and you are likely to fall. So you need to make that room very well littered so that you avoid the fall. Similarly, you see this particular picture, there is a electric wire is carelessly being put on the floor. So the person who walks might trip and fall, right? So better focus on such things. Keep the room very neat and tidy so that there is no hindrance for the elders to move around so that they can prevent the falls. I don't have to talk about our Indian roads. The roads are very narrow, the roads full of potholes and craters. So that we need to be vigilant. This comes under the category of environmental intervention, the hazards for the elders, which can cause falls. One needs to be very mindful about it. One need to be very careful about it while walking on the floor, walking on the outside environment in the community. Now I'm going to just further, this is so far we have seen what is the neurophysiology of balance and gait, what are the conditions affect the balance and gait, including elders, okay, and some of the factors like internal factors and external factors contribute for the falls. Now we are going to focus on how do we improve or maintain our balance. What is the importance of this aerobic exercise? That is the walking is important. That's we are going to see. And then if you time permits, we'll see improving physical activity through behavior change technique, person and environmental fit model. Now, okay, I'll come this later. So you need to improve your strength, you need to improve your flexibility, you need to do some balance exercise, a focused balance exercise. You need to improve your endurance, means you have to have a good cardiovascular fitness or cardiovascular endurance by walking, through walking, you are going to strengthen your heart so that you meet that endurance aspect of it. Sometimes even the pain in the joints also might cause some problem in falls. So you need to take care of that as well. So this is in nutshell, I have put it. Like how do you use some strengthening exercises, flexibility exercises, doing some particular balance exercises and endurance exercise, you can improve the falls.
Doctor, these slides are not showing. The slides, I mean, we are.
Are you in the prevention of falls in elderly slide?
No, it is not showing, doctor. I think the slides, I mean, you have to share slides once again.
Your screen sharing, it is there. It
Yes,
means
screen sharing is there.
you are not seeing the change in the slide?
No, I am not. We are not. We are not.
Oh my God.
I think that's what I said. You can even re-log in, or I mean, once try it again. The slides are not moving. We are still in the first slide only.
See, what is coming here is only you are viewing Selvaganapathy's screen, that's all, at the top. And so we don't see the screen as Mr. Jambanathan was mentioning.
I was mentioning earlier also whether it is you are able to see the slides moving.
No, slides are not moving, doctor. Slides are not moving.
That time it was told that yes, it is moving.
No, see, in fact,
Now you see it is full. Oh, it went off again.
this is the only slide. See, slide number 1 is coming.
Yeah.
Then after that, you are.
Now this much I talked so much. You didn't see it from the beginning, or it happened in the middle?
From the beginning, only these slides, this is the only slide that is available.
No, for us, for me, even that is not available.
So,
only the 17 slides chart is there.
And that is the thing. That is the only.
You are not seeing all the slides.
17, 18, sir.
18. See, only one slide which shows all the 18.
That's the what it is.
See, this is the. I mean, what I would say is that this is the. I mean, introduction to all the slides.
Okay.
So,
That in between, I asked whether you are seeing in this slide, particular slide. I asked, are you able to see this particular slide?
Now only it is working.
Now only it is.
Now it is working.
Now it should be zoomed. It should be
now you'll have to add. I mean, you'll have to go to the full screen,
enlargement.
full screen mode.
So
it is like it is in the slideshow mode now.
You have to zoom it now.
Slideshow full screen. In the slideshow also, go to full screen. Are you getting it?
Yeah, I get it. Wait. Let me see.
Full screen.
Wait, I'll go back to this.
On the left hand side, this is okay, doctor. Yes.
Let me see, but I have made it like 100%. Now
it is better.
Okay. So where you are not able to see, I think I had to
So
go.
that's a big question, I think.
Yeah, in fact, you can go back to from the first slide itself, you can go back to that and just briefly tell doctor.
Okay.
That will be because the slide screen is,
Yeah, that will be more useful.
Now
no,
you're seeing slides moving.
no, slides are, stuck up now.
Now,
It is stuck up. In what it is
Yes.
only in one slide, it is stuck up.
Are you able to see my slide?
One slide I'm able to see it. After it is stuck up there.
table chair one is
The
stuck up.
table and chair we can see.
Only the table and chair.
There is a slide is not actually dynamically moving. It is something stopped over there. Wait. Stop sharing.
What, Mr. Jambunathan? Now it is you have covered the slide screen. We can
Wait.
see you.
Microphone setting.
The steps to prevent the fall. I think from there, I think we can go because we can't go back to.
Yeah,
What,
yeah.
Mr. Jambunathan? What is your opinion?
We can, sir. We can. See, in fact, that's very useful to us. That is,
Yes,
yeah,
but in that,
yeah. Steps
keeping
to,
the back
we can
factor,
go from the steps. We can go from the steps.
Okay.
Steps to avoid falls. Yes. Now, neurophysiology of balance and gait.
Yes.
Now it has come.
neurophysiology of balance and gait.
And disorders of balance and gait, how to improve
How to
areas of
improve
balance and
it.
gait, aerobic exercises, improving PA through BCT, person and environment model.
Wait, sir. Now I am not able to move the slide.
You are not able to move the slide. You go to slideshow, doctor. In your computer, you go to slideshow. In that slideshow, you can move one after the other. When you are sharing the slide, you will have to go to the slideshow. Yeah, you have come.
Organs of the feet, joints.
Right. Now again, slides sharing everything.
Are getting neurophysiology of balance and gait, eyes, sensory organs of the feet and
Next.
joints, muscular system. Now I think it is working, doctor. Yeah.
Able to see?
Cognitive system. Yeah, walking, gait.
Okay. How does our brain organize? Okay.
Yeah. See, we can skip all these things, external force.
Yeah. I'll go to
No, one second. You are talking about the test.
correct.
A little back.
Come to this aspect, like your how do we improve your balance as
Yeah.
a
Prevention of falls in elderly.
Yes. So I was talking about strength training, flexibility training, balance training, endurance training we have to do, and you have to even reduce your pain to improve balance and prevent falls. Okay.
Yes.
So now, so this is what we call it as strength training. You have to do, even though you are getting older, doesn't mean that you should not do strength training. It is advised whatever we do continuously only it is retained in our body. So one point of time we stop doing activities like when we are retired or when we take some superannuation, our activity we generally reduce it. Before to that we might be going to the office, you might be doing a lot of work that will have been taken care, right? Or some of us even at that time we may stop doing many of our work. So the more we do, it is better functionally. By chance, if you are not doing much of work, lifting weight and all these things, then some strengthening exercises we can do, like taking weights, right? So a mild, simple gym we can do. So sometimes even we can make a simplified version of it, not necessarily to be the same one for an adult. Similarly, for flexibility, you can stretch the whole body muscles. Maybe a physiotherapist can actually help you out how to stretch each muscles in the body so that we can meet the demand of our body so that our balance is also maintained. And I said that the aerobic exercise to improve your cardiac fitness, like you are able to walk for long distance, is possible only if you are strengthen your heart. Your heart will be strengthened by walking at least 30 to 45 minutes every day. You can do many way of aerobic exercise, that is swimming, at least 20 minutes like that, or jogging or running, all these things. But simple, easiest way is walking for 30 to 45 minutes. So it is proven that this has improved your circulation to your brain. So entire region of the brain kind of getting a replenished blood. Okay, so now these are the ways you can simply maintain your balance. You don't want to do gym exercise or flexibility exercise. Are you able to see my slides, sir?
Yes, sir.
Tai
Yes,
Chi,
now
Tai Chi and
absolutely
yoga.
fine. Now
Tai Chi and yoga.
absolutely fine. Yes.
So these are the some of the martial arts or some of the techniques if you learn, which will indirectly takes care of your strength, indirectly takes care of your balance, indirectly takes care of your cognitive function as well. Why cognitive function? Because when you are doing all these things, your mind will be completely occupied about your body movement. So you have cognition about your body movement and that flexibility aspect, strength aspect. So this is also proven to be very good for elders, very good for person with some balance problem to improve their balance. So it's a very simple form of martial arts, Tai Chi and yoga. We know it very well, different postures which will improve your balance. Now, you can also practice mindfulness. You can also learn balance exercise from physiotherapist. That I am sharing some YouTube videos. I'll try to play that YouTube videos, okay, so that you can have a glimpse about what are those balance exercises, okay. And how to stick to this, I will come later.
The behavioral changes are also, I mean, that's very.
Yeah, I'll come to know.
Yes.
Sir, now what we will do, that videos I'll show you later, so that all the theory part are done, only video will come later.
Yes.
So behavior change technique, why I'm saying is, like we were advising strength training, we are advising flexibility training, walking, endurance, all these things. Is it easy for the elders to do it? See, they may say that I am not interested. I don't have a place to go nearby any gym, or maybe I am ready, but no, people are not allowing me. No, in my home that no, they are not allowing me. So there can be many ways we can always ask excuses, right? But once you have decided to be fit, once you have decided to be active in your life, you need some behavioral change for yourself to make yourself fit into that. So this is what we are explaining here in the model of COM-B model. COM-B model means a person should have the capacity to do a behavior. A person should get an environment or opportunity to do a behavior. A person should have a motivation to do a particular behavior. Like behavior here, what I mean is that strength training, all this flexibility, balance training, all those things. How do you stick to that behavior? So your capacity level might be a problem. Like you may have to do work on yourself, right? So that it can be your muscle strength issue or something, that can be one problem. Or your immediate environment is not supportive, that we have to first identify which is the problem. Is it problem with yourself or problem with the environment, or sometime both the places like that. For example, this is the chart I'm mentioning. So you are as a person, you are actually ready. It means you are fit to do it. but the environment is not supportive. For example, you want to walk outside, but your walking environment is very uneven, very much difficult to walk. Then you have to fix your environment. Then only you are going to achieve this walking or whatever the intended behavior, correct? The similar way, the person, you may not be ready to do it, but the environment will be ready. For example, in Western countries, the roads are even, hardly any people on the road or a park. So environment is ready, but the person may not be ready for many reasons because his muscle strength is not good, flexibility balance issue is there. So he may require a daily physiotherapy session, right? So then we need to work on the person here, so that we can encourage the person to do the particular behavior. And sometime both will be in fit, then we don't have to do any action. So only thing is they have to do that behavior. The behavior will automatically happen. The fourth one is neither the person is ready, the environment is also not ready for such things. We call it as there is no fit between the person as well as the environment. So overall, this is the theory called person environment fit theory. So this level, we need to identify where is the problem. This behavior of the person, elderly person, is not happening to live his very physically active lifestyle. Then we can intervene at the individual level. So that can be including sensitizing your society, policy level change from the government. All these things also will come into picture to prepare the environment, like elderly friendly park, home and buses. Buses, you see, sometimes the steps are all very much at height. The person might struggle to make a step on it. So these are the sensitization program we have to do with the governments to make it more, elderly friendly. So what I'm trying to make a point here is, if you are ready to do alone is not enough, because your environment also should be supportive. Then only you may carry out certain behaviors like physically fit or physically active elderly person. So we have to have an understanding about this. That is what I'm trying to bring the change, bring that particular slides to give an idea about it. Now, here also, if a person is not motivated, you can work on how to improve his motivation level, right? One of the simple motivation level is you join in a group. The group will take you forward, right? Like the VMS group, like many people are there together, they may carry out some activities. Now, let us see some of the balance, strength exercise, flexibility exercises. So these are the YouTube videos. I hope it plays.
It should.
Mm.
Balance training. Yes.
Yes. So you can please watch some of the balance exercises. Yeah,
So
showing.
is it available for all of us to view?
Yeah, like we generally give it for people who comes here and learn it. But I think we can share it. This YouTube link, you can always watch. All of you can watch.
Yeah, that is,
So
I mean,
this is especially for seniors. They have to hold on to that sort of furniture in front and do it. Should not do without holding anything.
yeah, so that
This is
will,
one. And
yeah.
are you able to see, sir, exercise?
Yeah. It's working. It's working. Absolutely no problem. Hold on to support, lift both heels and both feet alternatively 10 repetitions.
Yes.
So that is at 22.
Then next video. Sorry.
This is, yeah, claps hand. Yes, with one hand support.
Correct. Okay, next.
Stepper.
Sorry. This person is
Clasp hand.
yes, trying to get up. While getting up,
Yes.
keep both the feet little away and hold arms in front. why we are insisting this is some of the elders don't try to bend forward. They try to go back and get up. That is why they fall. So the trunk, whatever this trunk we are saying, no, you are bending forward and getting up. That we are trying to teach here. So, and then walking,
Yeah,
so
yeah.
simply standing one in front of other, sorry, 1 feet in front of other and close your eyes.
Hmm.
Again, please do it with supervision, sir. This cannot be done independently. Do not do it without anybody else supervision. This is good to make your brain and vestibular system trained to improve your balance. But safety is very important. So do not do it without somebody's supervision. This is standing on one leg. You're able to see, right?
Yeah, we are able to. Yes, doctor.
But doctor, most of us elders are lonely. We are living alone.
Sir, then don't do alone. We will, that's what I told. See, some of this, that environmental model, your environment is not supportive. You need some support group like we have a program, something like volunteers to come to your home to make you to do the exercise. So there are some government programs, there are funding available there. We take care of elders by making them do exercise by coming home. Such programs are all to be implemented in your places. We can initiate some project with the help of the government, the area where you belong. You are from Tamil Nadu, sir?
No, he's from Karnataka.
Karnataka only.
Bangalore.
Bangalore.
Then
Very
very
much in
much
Bangalore.
possible because there are some program in Karnataka Health Department called Karnataka Brain Health Initiative. Under that project, we can definitely reach out to your home and teach you this exercise, sir.
Okay, thank
But
you.
teaching is fine. But
That's a
doing
program
it.
called Kabi program. So that we can reach out to you. It's called Karnataka Brain Health Initiative.
Karnataka Brain Health Initiative.
Yes, Kabi. In short form.
Kabi.
Doctor, yeah, I have a question.
Yes.
Rather, my observation I want to share is
Yeah.
standing on one leg and also tandem gait. What happens when I am standing straight? That is, the center of gravity is passing through the axis of the body. Then it will be easy. So for example, when I while doing tandem gait, I count up to 15 comfortably. Well, even if it's slightly disturbed to the left or right, then obviously the one axis and the line passing through the center of gravity, these two lines cause disturbance and I lose the balance. So the observation, what you mentioned particularly, even though somebody has to supervise that also.
Yes, sir. Yes, sir. I advise you to now get it checked with us at least. You are in Bangalore, right?
Yes, I am in Bangalore. I am associated with the Nightingale Medical Trust.
Cool. Very good, sir. Then definitely
we do all these exercises.
You can please come to us for once for our assessment in NIMHANS. We have a balance and gait lab.
Okay.
So, you can see we ourselves can advise you based on the assessment what we conduct. So these are the exercises I'm generally teaching, but individual will have a different problem, as you are rightly said.
Though these are minor, they cause quite a bit of disturbance.
Yeah, definitely.
Whom should I contact? That is a geriatric department or what?
Yes, sir. Yes, sir. So please visit us. I am going to share my number. I am going to share my email ID. You can contact me and come also.
Yeah, you can.
Yeah, in fact, that I have specially requested doctor to help us out.
Yes.
So in case anybody who likes to meet the doctor at NIMHANS, he can always reach out to him through his email. and fix up a program or appointment or something like that, then go to NIMHANS. Therefore, he can guide you as to how to go about.
I mean, you
This
can,
is
you can put it in the chat box or.
Yeah, he'll put it in the chat box.
Okay, that will be nice.
this is
Thank you.
Tai Chi, sir. This is how the Tai Chi exercise is done.
Mm.
You can see how the person is moving his body slowly like that.
Mm.
So recently I switched over to walking stick also sometimes.
Okay.
I'm 82 now.
Oh, 82.
So using a walking stick is always good, isn't it, doctor?
Yes, sir. Why? Walking stick will give you some extra information to your brain about the surface you walk, sir, so that your balance is better.
Yes, but the only thing is we get a hunch. We can't walk as without stick. We can keep straight and walk. When we are using walking stick, slightly our upper portion of the body comes forward.
Okay, okay.
I mean, these are all this. Just I keep.
Yes.
As you said, the cognitive exercise keeps on going while walking with stick.
Correct, correct, correct.
And I used to do.
Sir, shall I stop now?
Yeah. No, sorry. You please continue.
Continue,
No problem, sir. No
continue,
problem.
sir. Continue, doctor.
We went for this.
For another 5-10 minutes maximum.
So stop screen.
When you have got your own appointments also.
Yes, sir. I'll again.
See, I know we have. I mean, we have run out of the time. I know that we are already overshot our time. Just another 5 minutes.
Yes, sir. Yes.
Summarize the whole thing.
Yeah, I'm going to do that. I'm just looking for my email ID pages. Yes. I'm going to share it now. Okay, now.
So most of us who have come on this seminar, I mean, for this webinar, most of us are doing some kind of exercises in NMT. NMT have got a program. I mean, they have active aging program.
Very good, sir. That is what I'm expecting.
Yeah.
All of you to just.
These NMT programs we do, and most of us are good walkers. And in fact, I myself do lots of yoga exercises, etc., etc. So okay, I mean, I'm not today. It is not a problem, but over a period of time, I'm anxious that it should not become a problem.
No,
And
sir. Actually, something like make a habit of your exercise for longer time. That is what I'm trying to make a point here. It should not be like only for some time or something. It's a lifestyle. This is what in Ikigai also they say. Whatever we do, we have to continue for longer time so that we are able to maintain it. If you are thinking that once I have done, that is enough. Or one point of time, in my life, when I was young, that is enough. No, you are there till the last day. The last day also, the exercise has to be there.
No, longer time means the day, every day I am working for about, that is to be lengthened, or continuously you have to do?
Continuously, bus. I don't want you to keep on increase it. Same thing every day. Half an hour exercise, half an hour every day. So that you cannot stop. Whatever the reason is there, you cannot stop.
Selvaganapathy sir cannot be called a senior, sir. He is quite a junior.
I am 72, sir. You cannot call me junior.
That is not a senior age.
Sir, sorry to interrupt. Can you see my phone number and my email ID?
Sorry, sir, it is not showing up, sir.
Okay, I will again stop sharing.
You just tell me, sir. I will note down and I'll put it. Or you can put it in the screen. I mean, chat, sir.
Chat, I will put it.
Yeah, chat you can put it. Email ID.
Right.
Yeah, probably phone number will be too much of a disturbance. Chat will be fine.
Okay, sir. I'll put it.
Mail ID will be fine.
Messages, I'll put it.
Yes, as a message, if you put it. All
Sir,
can see.
I think I'm spending little
chat, yes.
Also, can you note down? It's Selva, SELVA.
Selva.
All small letters?
Yeah, all small letters.
22
22
74 2274
at Gmail. I'll put it in the chat, sir.
Yes, sir.
Telugu,
So now I would like to summarize, like
2274, isn't it?
yes, sir, at gmail.com.
2274 at gmail.com.
Who.com?
At gmail.com.
Yes.
So I'm just putting it in the chat. Is it SELVA 2274 at gmail?
Correct, sir.
Correct, sir. Correct.
So at the
Also,
end,
just note down, sir, please.
yeah.
Ladies and
Selvaganapathy at gmail.com.
We have learned what all our brain and your muscles and your sensory system like vision, your sensation, all contribute for the balance. So whenever any problem in any one of this region will lead into balance problem, then false problem. So false happens, then you get your bone fractured, you are not able to walk further. That will deteriorate the function. So better to prevent fall. So these are the systems we have to keep it in check. Your muscles should be very strong. You should be flexible. You should be able to use your cognition well. It means your judgment ability. Like that is why mindfulness practice is very important. What is going on in and around, know that you're observing your floor, sounds, everything. If you have hearing impairment, immediately check and get it corrected. So all these things are all helping our balance so that we can live a very fit life for the longest years. Because one of the reason the elders are not able to live longer is that falls. And once they have fallen, then the fear of fall is there. They're finding it difficulty to overcome that. So hope some of this exercises what we shared and the reasons of falls what we shared is of some useful to the elders so that we can take some initiation. So further queries kindly be in touch with me with my email ID, maybe my phone number, maybe if it is required, Jambanathan sir can share. So that's with that I would like to conclude, sir. Thank you very much for giving me this opportunity to interact with you all.
We thank you for sharing this knowledge and taking us forward.
My pleasure, sir.
Thank you, doctor.
Thank you, sir.
Any other person like to talk, sir? Any other person? Any other person likes to thank our doctor for this? He has spent so much of time with us.
Jambanathan sir, I just want to
please come.
I just want to ask the doctor that someone who had already has Parkinson's can benefit by this physiotherapy or
Yes, absolutely yes. Because in Parkinson we have special exercise program which is not shown in this thing in elderly form. So you can definitely be benefited with a specialized physiotherapy program for Parkinson's.
Where can we
you can contact our centers. Where are you put up?
Bangalore.
Oh, then very well you can visit NIMHANS. We have a balance and gait lab in the Department of Neurological Rehabilitation and Physiotherapy. You can please visit us. You can take our email ID. From
I took that.
Please contact me. I can further give you directions.
Can you share your mobile number, sir, if you don't mind?
Yes, yes, you can take it. I have already.
Yeah, I know it. I will give it. Don't bother.
Sir will share it.
Yeah, I'll share.
Any other queries, sir?
Any other person likes to ask any other query? In fact,
yes, sir.
Yeah, please start the problem. Please come along, ma.
I do a regular walk for about 45 minutes to an hour, and I do my yoga every day also. I've been doing it for the last say 15 to 20 years. But of late, everybody has been complaining that I'm walking very slowly, and the slowness is becoming more and more. So I was wondering whether I should really visit your lab.
Absolutely. You must get it checked. I told whenever the slowness is there, we have to do further investigation, right? So that we can find out the cause.
Perhaps slowness is the first indicator.
Yes,
But
yes.
yes, the something is not okay.
Right.
But Dr. I'm seriously asking.
Hmm.
Is not age related? Age is not age a factor to reckon with for all these things?
So what is exactly your question, sir? Age
It's
is
not the age. It's the
Ah.
age of a person.
Ah.
It is not responsible for all these, kinds of this thing. Our disorders.
No. See, it is the mostly the brain structure. What all I have mentioned, it can affect at any age. So preferably, most of the conditions are at the later point of time as we get older. That is why it is mixed. Like Parkinson's and all generally comes at 60 years. So dementia, it is comes at the later age.
Yes.
So that is the reason age is one of the risk factors to develop all. So we are saying that keeping the cognitive reserve, keeping our brain little active by having a very active lifestyle, we are recommending it. Aging, why it is a risk is your body is slowly deteriorating, right? We are not also maintaining the same amount of physical activity. Two problems is happening. One is our body itself is losing some of the power what we had, and we are not do anything to match it up. So second thing is we are leading a very sedentary lifestyle. We are not do any physical activity because of whatever the reason. So either you yourself don't want to do or your immediate environment not allowing to do, that will make this process very difficult. So then the fall risk is increasing. So aging is one of the risk factor for falls, but many other conditions can actually leads into major falls like diabetic neuropathy. They cannot feel the floor of the feet. So when they are in that case, they will use the vision. They use the eyes for balance. But when they are in dark environment, they might fall because the eyes what they are using, they cannot use it at that time. So these are the ways, this aging coming into the picture. Otherwise, any system which is affected for any reason at any other age also is actually a risk for falls.
Thank you, Doctor. It helps this very clearly explains. Yes. We can, this intervention can happen at any time, irrespective of the age.
Yes, sir. Yes.
It is only risk reduction processes.
Yes.
Yeah.
Active aging is healthy aging.
Yeah.
We can't defy aging.
Yeah. Yeah. So we can, sir, we can prepare ourselves better. So that it is aging is some risk is giving. So let us be prepared for that. Then we can have a very fall-free lifestyles.
I think it's time that we should not further tax doctor. We have crossed 30 minutes. We have taken 30 minutes.
Sir, no problem. Nice talking to you all. Nice meeting you all. Happy to be associated with you all again.
Very kind of you. You could share so much of knowledge and made us much more this one. I should say you instilled confidence in us to move forward.
Thank you.
Yeah. See, the help and the interventions that are available in our situation. That is why I was very careful about choosing this particular topic of gait and balance. Because this is one important aspect that, in fact, everybody cautions us. They say that what are all the risks in the old age? The first risk is falling.
Yes.
So how to avoid fall? How to avoid fall and how to maintain our gait?
Yes.
The gait is something it is not available only at our, it's not tested only at the lower ages. It's higher ages also. And what are all the interventions that are available to us? What are all the tests that are available to us? And see, what are the recent developers? In fact, he said that it's a good introduction about him, but if I like to introduce about him, I may have to take about half an hour. He has done so much of work on that.
My interest is to this concept of fitness in our elder population has to reach. So that is our motto. Even our nation also going for aging population. So our aging population is going to increase in coming years. If you are not preparing them early, So these problems all will come. So we are trying to do a small part to keep our seniors very fit and active lifestyle. So this may be a small help to them.
No, it's a great help, doctor. See, in fact, being informed about that and being ready to face it and trying to and knowing what are all the support systems that we have.
Yes, yes, yes.
That is all a great help to the seniors, doctor. See,
Yes.
this I understand. I agree with you that through this Vayomanasa Sanjeevani initiative, we try to give information to all, and the information is a very, very authentic information. It is not a WhatsApp university information. In WhatsApp, you get so many things, but it's all very, not reliable at all. Here, we are concentrating, we are on doctors who are all well experienced, who are trained, and who are qualified to talk about.
Hello.
That way only
Hello.
we are doing. Hello.
Hello. I'm speaking from Bhopal.
Tell me, sir.
Oh, my wife is suffering from this gait movement disorder problem.
Okay.
And we had been to NIMHANS also, to Dr. Paul and Dr. Kamble, Nitish Kamble. So we just want to come in the month of January for this your therapy, physiotherapy.
Okay.
So is it possible to
Yes, sir.
meet you there?
Yes, sir. Please visit room number 15 in physiotherapy building. There's a
Okay.
balance and gait lab. I'm the in charge of that. You can meet me over there.
Please tell me your name, sir.
My name is Lakshmi Narayan Induria, but my wife's name is Mrs. Prabha Induria.
Oh, Prabha, yes, yes. Prabha.
Prabha Induria.
Okay.
She has gone to NIMHANS.
Okay.
We were there,
Yes,
and
sir.
Dr. Paul, he
Movement
told us she is not having the disease, but gait problem is this.
Okay. So please come. Please
Yeah,
come
yeah.
and visit. I am available in the January, no issue. Only in December end I am not there. So
Okay.
January certainly I am available, sir. Please do come.
Where we have to meet you?
Room number 15, first floor, physiotherapy center.
Physiotherapy center. First, I have seen your physiotherapy center. I have
So
seen.
you please come to room number 15. Yeah, please. You can
First
come in
floor,
January as well.
15, room number 15.
Yes, sir.
You are right, sir. You are right. Room number 15. You are right. Sir, I would suggest, sir, before going there, before you just send him a mail. You have taken.
But what is your mail ID?
In fact, I
Yes,
have given, sir. In fact, I have written it in the chat. SCL, in the chat it is available. I will read it again. S for sugar, E for English. S for sugar, E for English, L for love.
Acha, Selva.
Selva.
SCLVA.
SCLVA. 222 numerics 2274. All letters 2274.
2244. Selva 2244.
No, not 444. 2274.
Oh, sorry. 2274.
At gmail.com.
@gmail.com.
You are right, sir. You are right. Please send him a mail. Sir,
Okay.
today itself,
Medical support also.
Yeah, you can send him a mail. See, I also my mail ID, J for JAMBU.
I know him, sir. Yamunathan, sir.
Ah.
I actually was talking about Prabha. She's my sister only.
Okay.
And I can share everything with you.
Okay.
About him.
Okay.
And,
Okay. Sure.
Yeah, and I can share your number with him.
Okay.
He can talk to you or even Dr. Selvaganapathy.
Yeah. You can.
Okay.
Our objective is that to reach out to people and help people. We'll be really happy if that is so. See, in fact, the NIMHANS have got such a beautiful set of doctors who are interested in service alone. See, in fact, one has to visit NIMHANS to know the kind of treatment, the kind of, services they are doing. From morning 8 o'clock to evening 8 o'clock, so many outpatients come and none of them are turned away. Everybody is seen.
Your number is available there on this one, the
Sir,
group.
madam,
Your number.
Can I have your email ID, Mr. Jamunathan?
JAMBU 48.
48.
Yeah, at gmail.com.
Okay.
And doctor,
Tell me.
persons with low sodium will also have balance problem, is it?
Yes, yeah, it can cause some problem. Definitely, low sodium will have problem. Even postural hypotension. It is called elderly. It is very common when they are getting up suddenly. The BP will reduce. Then also fall can happen. So whenever you are getting up, you have to be very slow. Before you have to stand for a few minutes. Sometimes cross your leg and tighten the muscle and then go. So low sodium is there, then that problem, you please consult the doctor and take appropriate measures.
Okay. Thank you, doctor.
Madam, Vasudha madam, we have also done one program on low sodium.
I missed it.
Yeah, it is available in YouTube.
Okay.
I will share the YouTube link also for you. In fact, I only did that
Thank
program.
you, sir.
In fact, one doctor from Delhi. See, in fact, low sodium is, a risk that needs to be immediately attended to as fast as possible. It needs to be attended to as fast as possible. I'll share the program also to you, madam.
You can share in the group, sir.
I will put it in AA group.
Yeah.
Okay. Already it is getting late for Dr. Selvaganapathy. Thank you so much, sir, for being patient. Being so patient with us. Should really thank you so much.
Thanks a lot, sir.
For being so patient.
Doctor, thank you very much.
Thank you. May I take leave?
It is a pleasure to thank you. In fact, as a return, what is that we can do is that all of us will pray for the welfare of yourself, your family.
That is true. Yeah.
The only thing that is